In clinic yesterday, we had several patients that had surgery and they were worried that their symptoms were coming back. They had a little twinge of pain here or a little tingling here. And I want to just talk about that for a minute. It's very common in the postoperative period, first of all, to have some symptoms that are reminiscent of the symptoms present before surgery. The reason for that, I think, is that we've just operated around the nerve, and the nerve is subject to the fluid and blood products that are present at surgery, and that process for all of that to resolve takes a few weeks. So if your symptoms are better than they were before surgery, but there's some tingling or there's some numbness, be assured that it's likely normal. And it's likely that nothing is wrong, or another way to put it is you're unlikely doing anything to make it worse. I can understand the anxiety of having severe pain come back because you had surgery in the first place, and it's very scary that it will return. One of the concepts that we have discussed at length in our practice and with our patients is the concept of mindfulness. And one principle of mindfulness is acceptance of your symptoms the way they are. And I think that a really good reminder in this situation is to pay attention to how your body is feeling, accept the symptoms that you are having, but not make them worse. Not worry that this little twinge here means that something worse is coming, and be mindful and in the moment of what you are actually experiencing. So that may be one helpful way to decrease anxiety. If you have questions about things, let's talk about it. Let's talk about whether or not this is normal to be experiencing or whether it's abnormal. And I think if we can have that conversation and identify which things are normal and which things are abnormal, that might offer some reassurance. And if it's something that's abnormal, we may be able to do something about it. Most patients that have had surgery that experience reduction of their symptoms will go on to have ongoing and lasting improvement long term. And I hope that that's the case with every patient that we see. Sometimes symptoms come back, sometimes problems recur, and we can address those. But let's take it a step at a time, and let's talk about any concerns that you may have after surgery that are causing anxiety, because we don't want fear and anxiety to dictate how patients recover. We want it to be focused on goals and objectives and being mindful and getting your life back and being as healthy as you possibly can be.